Meet David, a man in his 50s. He's been dealing with progressive joint pain and stiffness, primarily in his hands and wrists. Symmetrical joint swelling, tenderness, and rheumatoid nodules were all evident upon examination. Blood tests revealed elevated levels of rheumatoid factor and anticyclic citrullonated peptide, or anti-CCP antibodies. X-rays showed erosive changes in his joints. Now, the question we're looking at today is, what could be the underlying mechanism of this illness? First up is IgG binding cell surface protein. This mechanism involves the binding of antibodies to cell surface proteins. It's seen in diseases like Goodpasture syndrome and rheumatic fever. However, this doesn't seem to align with David's symptoms or test results. Then we have IgE binding antigen. This mechanism is commonly seen in allergic reactions. It involves the binding of IgE antibodies to an antigen, triggering the release of histamine from mast cells. However, David's symptoms don't match with this mechanism either. Next is complement fixation. This process involves the activation of the complement system, a part of the immune system that enhances the ability of antibodies and phagocytic cells to clear microbes and damaged cells. While it's involved in many autoimmune diseases, it doesn't quite match David's clinical presentation. The fourth mechanism is T-cell mediated. This involves the activation of T-cells, which then attack cells expressing specific antigens. It's seen in diseases like type 1 diabetes and multiple sclerosis. But again, this doesn't seem to match David's symptoms or test results. Last but not least, we have the specific antigen-antibody ratio. This mechanism involves the formation of immune complexes in response to an antigen-antibody reaction. This could potentially explain David's symptoms and test results. Based on these potential mechanisms, we can conclude that David's clinical presentation aligns most closely with rheumatoid arthritis. This disease is characterized by chronic inflammation due to immune complex deposition in the synovial tissue, which is a type 3 hypersensitivity reaction. This mechanism involves the formation of immune complexes in response to an antigen-antibody reaction, which matches our last potential mechanism, the specific antigen-antibody ratio. So let's recap. David, a 50-year-old man, presented with joint pain, stiffness, symmetrical joint swelling, and tenderness along with rheumatoid nodules. His blood tests showed elevated levels of rheumatoid factor and anti-CCP antibodies. X-rays demonstrated erosive changes in his joints. Of the 5 potential underlying mechanisms, the one that best matches David's symptoms and test results is the formation of immune complexes in response to an antigen-antibody reaction, consistent with rheumatoid arthritis. And there you have it, a deep look into the potential underlying mechanisms of David's illness, and an explanation of why rheumatoid arthritis is the most likely culprit. The world of medicine is a complex one, but by breaking it down piece by piece, we can begin to understand it.